Welcome to the Shatkin F.I.R.S.T Monday Morning Minute.
Hi, I'm Dr. Todd Shatkin, and today we're going to be extracting tooth number 27 and possibly 26 because there's an abscess involving both teeth. I'm going to try to take care of just 27, which is mobile. 26 is stable, but there is some decay under the crown on 26, so we're going to take a look at that when I get the crown out, or the tooth out. So right now, she's already been anesthetized, so we're going to extract number 27. Okay, so you can see the big abscess at the tip of that root. Now we're going to curette out the infection. You want to make sure you remove all the granulation tissue from the socket, otherwise you're sure to have a problem with healing. So tip your head up for me, please. Even though there was quite an abscess on the root itself, there's still a lot more infected tissue in here, so we'll clean that out. You want to make sure you curette all the way down to healthy bone. Next, what we need to do is remove all of this granulation tissue. So I like to excise that tissue. Tip your head up for me, please. So we're going to remove all of this infected tissue. Okay. We decided to use a 3.75 by 13 mono implant. So we're going to put our drill extender on, and we're going to use a 1.5 pilot drill, which is the gold pilot drill. But it also comes in silver, so don't be confused sometimes. But we're going to go ahead and try to Okay, we made our pilot hole, and you can see a little bit of bone on the tip of the drill. And that's a good sign. That means you got good bone. So here's our 13 by 375 implant. Just going to get that started. We got to find the hole here. There we go. Just finger driver. Okay, so we got it started. Now we can place it a little further. That's 30 Newton centimeters. Now we're going to go up to 60. And we're already beeping at 60, so that's good. Now let's take this off. And there's the implant in place. Let me just have the ratchet. Here's our ratchet driver. Just going to make a little bit of a bend. Small bend, okay? All right, perfect. Okay, can I have a bone, please? Which is that? Okay. So I'm going to take a bone graft, and I'm just going to cut it into a couple slivers so I can slide it in. Right into the extraction site and plug that big hole that we had there. What that will do is it'll act as a matrix for new bone to form. I'll put a little more here. Now, of course, if you prefer, you can use PRF, LPRF, which is when you take the patient's blood and spin it out and form a clot. But I really like these bone plugs. They work really, really well. So I'll take a little bit of hemostip, and I'll take my hemostatic dressing or hemostip, and we'll put that over the top. We could just kind of form it around the implant. Stay open. Okay, we're all done with the procedure. I'm just going to put a suture in there. We'll do a horizontal mattress suture. So we'll go around the implant. And that'll pull it all together. Just like this. Sheila's been coming here for a long time. We've done a lot of work on her, and most of her work is doing just fine. Okay, so the procedure is all done. Now we're just going to make a little temporary tooth. So there's the implant with the suture, bone graft, little bit of composite. I make a little ball of composite. And this might be too much. I don't even need that much. Let's see. Okay, a little ball of composite. I'm going to put that over the top of the tooth of the implant, and that's perfect. Just bite together. Okay, open. Hold on. Cure that. Open.
Okay.
Okay. All set. I'll check the bite. And bite together. Open. It's not touching. Looks great. Okay, we're all done with the procedure. We extracted number 27. We placed a mono 3.713 implant, packed some bone around it, some hemostatic gauze over it, sutured it up, made it temporary, all in about 10 minutes. Thank you for listening to the Monday Morning Minute.